All right, our weekly OrthoVirginia segment on this Wednesday morning, joined now by Dr. Tate Hepper from OrthoVirginia. Dr. Hepper, thank you so much for taking some time out of your day.
My pleasure. Thank you for having me.
Of course. I just want to start. Are you staying warm, staying safe in the streets with all the snow out there?
Good, actually. I just had to drive from one of our other offices, and it's warming up, and the roads seem fine. So yeah, this morning was a little dicey, but it looks good now.
Yeah, it was a sheet of ice where I live, and it has warmed up quite nice, or at least sunned up, I'll say, quite nicely.
Yes.
I want to start here. How do you keep up with new research and assess new technology and procedures for treating wrist injuries? Because you work with wrist, hand, and elbow, which we'll get into in a little bit. Quite topical in the world of football.
Right, right. Yeah, I mean, still the best way to keep up with that stuff is through medical journals. And for me, that's most commonly the Journal of Hand Surgery, which is published by the American Society for Surgery of the Hand. And that's definitely the best way to get the most up-to-date science, so if things actually work. If you're talking about techniques, that can be a little tricky to learn by reading a journal, obviously. And so for most of that stuff, I rely on knowing people in the field, and I'll go and watch somebody do something if they've got a new technique or something like that.
Dr. Hepper from OrthoVirginia joining us this Wednesday morning. And I mentioned it there. You're not working specifically with these athletes, of course, just using your expertise to kind of help us make sense of a lot of the injuries we've seen. We saw Justin Herbert on Monday Night Football battling through a hand injury. And I kind of want to start with that because Justin Herbert, quarterback for the Los Angeles Chargers, he underwent hand surgery 6 days prior to the game. And as a normal person who, when I have surgery, it takes me weeks to bounce back. How does he have surgery 6 days prior and bounces back to play in an NFL game?
That's a great question. And, some of it is that they will be very aggressive with surgical procedures for, professional athletes to get them back playing sooner. So that might be an injury that the average person would elect not to have surgery for and just let heal. And then if that's the case, you're going to have to be immobilized and not active for a longer period of time. And I don't know the specifics of his injury, but I suspect what he had was a relatively minor non-displaced fracture, which they were able to stabilize with like a screw. And by stabilizing it, they can allow him to get back to activity a lot sooner than you otherwise would.
That makes a lot more sense because, yeah, I imagine if I had a slight hand fracture, I probably would just be like, I'm fine. I don't need surgery.
Well, and I don't want to minimize him either. I mean, he's obviously a tough guy. So, you're right. Most people would not have surgery and go back to playing football in a week or so. Yeah.
Yeah. Justin Herbert somehow plays through every injury possible. And I think he played through broken ribs a couple of years ago, which I can only imagine that pain. Another person with the elbow side of things, and he's been in the headlines a lot. Again, you're not working directly with Jaden Daniels and the Commanders, but offering your expertise. Jaden Daniels, he suffers what looked to be a gruesome elbow injury, kind of best case scenario. He works his way back. He plays against the Vikings on Sunday. Then he falls on that injured elbow. Is that re-injury something that happened because of the prior injury, or is this just bad luck?
I think he's probably at a slightly increased risk of re-injury because he came back relatively quickly. But then also it's, some of it is bad luck, just like any injury. In general, though, an elbow dislocation, once you've reduced it, it takes probably 6 weeks for those ligaments that you've injured during the dislocation event to heal well enough that we feel comfortable saying, go get back at it. He's obviously a professional athlete that's got access to all the best rehab and stuff. So I think it was probably a reasonable decision. But so the answer to your question is probably a little bit of both, right? I mean, it was probably, he's at a little increased risk of re-injury, but it's also pretty bad luck too.
Yeah. And that kind of sums up the Commanders. I don't know if you're a Commanders fan, but sums up the Commanders season in a nutshell.
I grew up in Nashville, Tennessee, so I've been a Titans fan all my life, which is hard to stomach right now. I mean, that is very hard to stomach right now. So I am slowly becoming a Commanders fan. Don't tell my family I said that, but they're becoming more appealing to me as I live in the area longer and as the Titans tend to go the opposite direction.
Yeah, I'll keep that one quiet. I won't let them know that you're turning into a Commanders fan. And I think the worst thing that happened for the Titans on Sunday was the fact that they won, taking themselves out of the #1 overall pick. So your team's not doing too great when you're cheering for losses. So I can.
But Shedeur Sanders started that game, right?
Yeah. Made him look like an all pro, but hey, that's why you're slowly transitioning back over to Commanders fandom. We talked a little bit about surgery specifically with Justin Herbert. For us average Joes, and when you're working with your patients, how do you describe minimally invasive wrist surgery to your patients?
Yeah, so the most common minimally invasive wrist surgery that I do is a wrist arthroscopy, which is basically the most people call a scope, which you'll see most commonly in the knee. Lots of people have their knee scoped, but we do that in the wrist as well, usually for ligament injuries. And so that involves putting a small camera into the wrist, and then we can look around the wrist and see exactly what's happening, and then deal with it that way. So it's a relatively short outpatient procedure that involves small incisions, which speeds up your recovery.
This may make me sound dumb, but this whole time when players get scopes and things of that sort, I never realized it was an actual surgical procedure. I always thought they were just like getting their knee looked at, and I was like, that stinks.
It is a surgical procedure, and it's called a scope because you're actually putting like a little camera into the joints to directly visualize, and that's all done digitally now. Obviously, we have these high definition cameras that have these. The original scopes, they literally were taking like a camera and looking directly through it into a joint. I mean, that was decades ago, but yeah, so pretty cool stuff.
That's awesome. What types of wrist injuries can be treated with minimally invasive surgeries like you just described?
Yeah, I mean, so the most common ones are ligament injuries. So there's several ligaments in the wrist that can be injured during sporting activities, and those are easily treated through a wrist arthroscopy. Probably the most common minimally invasive surgery I do is not really injury related. That's a carpal tunnel surgery. So exceedingly common problem in just the general population, and that can be treated minimally invasive.
With carpal tunnel and things of that sort, are there ways for someone like me who I work with computers on my phone, and that always seems like ways that could potentially develop carpal tunnel down the road? Are there ways to avoid getting carpal tunnel down the road?
Yeah, that's a good question. And the answer is probably no, unfortunately. We don't really, there is this conception that typing and being on a computer causes carpal tunnel. It probably does not. It can aggravate it. I think there's probably a significant genetic component to carpal tunnel. So carpal tunnel is called carpal tunnel because there is a tunnel in your wrist that has a nerve traveling through it. And for some reason, that tunnel gets too tight for the nerve. And so it makes sense that if you're born with a tunnel that's a little smaller than everybody else's, you're more likely to develop carpal tunnel at some point in your life. And it's hard to change that, obviously. So, yeah, I mean, the short answer is no, unfortunately. But good treatments for it, obviously. So.
Yeah, that's really interesting. I never knew that side of it, that it could potentially be genetic. Looking at wrists as well, what wrist injuries require traditional kind of open surgery?
Yeah, so the most common are fractures, broken bones. And we see a lot of what are called distal radius fractures. That's the bone directly below the wrist that goes up to your elbow. Commonly injured during sporting activities with just a fall. And that typically, if we're doing surgical procedure, requires an open procedure to put a little plate and some screws on the bone.
This is a question we've asked a couple of different OrthoVirginia surgeons throughout this time, but with the rise in pickleballing that we have seen across the country, have you also seen a rise in maybe some wrist fractures?
No doubt. I mean, that is a very common injury. Yeah. I think you get people out there, the weekend warrior, so to speak, that are just super competitive and going after that ball that maybe they should just let go, and they end up on their face and have a broken wrist. Yeah, super common.
Yeah, it's bringing more business to you guys, so I guess that's a great part of it. But man, pickleballing seems to be pick it up at your own risk. If someone happens to have carpal tunnel, like we discussed, if they happen to have a pickleball injury, where can listeners go to schedule an appointment with you guys at OrthoVirginia?
I mean, the easiest way is online at orthovirginia.com.
Awesome. I love it. Keep it easy, keep it simple, and listeners can remember that well. Dr. Hepper, thank you so much for taking some time out of your morning to chat with us. Stay safe as the snow still melts away here in Richmond.
Likewise. Thank you for having me.